Okay, so Dr. Wu and I are going to be presenting a few slides on the topic that you see. We have a special guest with us today, Mr. Earl Paldrell, and his wife Kathy and his daughter Kristen are here, and they have a few other people along with them that they may introduce later. But it's our special pleasure to welcome them and to thank them for coming today. Mr. Paldrell, as you can see, is a patient with locked-in syndrome, and we're going to get a really nice perspective from the patient's side in regards to this disease. And so I wanted to first give them a round of applause for coming today. We'll have an opportunity to ask him some questions and his family some questions at the end, so we can maybe hold our questions to that point. So the objective today is to discuss and understand the clinical presentation of locked-in syndrome, review the causes of locked-in syndrome, the treatment, the prognosis, understand this syndrome from the patient's and the family's perspective. And that's why we have the pleasure of welcoming our guest today. Dr. Wu and I have no disclosures. Mr. Paldrell, this is his history. So at the time, this was now 3 years ago, he was 56, he had no medical problems, and he was found down by EMS, by the ambulance drivers, I believe after they had to break down his apartment door. And at that time, he had been down for about 27 hours. My understanding is that he felt the stroke coming on and he kind of laid himself down, but they found him laying on his arm, and he had a lot of damage to his arm in terms of the cellulitis process that had already started. From there, he was taken to an outside hospital in Plano, Texas, and then he was transferred to us a few days later after being diagnosed with locked-in syndrome. And the family can tell you more about what happened at that time, but my understanding is that when he was in the ICU, he was seen by a neurologist once, and then he was followed by an ICU physician. And it was the family that initially recognized that Mr. Paldrell was actually awake. Initially, everyone thought he was in a coma and not responding, but his ability to track with his eyes slightly and just the look in his eyes, according to the daughter, it was clear that he was awake and he was not in a coma. And so the family recognized that he was locked in. They had to tell the physician he's awake in there. And the physician initially didn't accept it and didn't believe it. And you'll find later that there's a website built up around what happened next, because the physician asked Mr. Paldrell, what is the square root of 25? And Mr. Paldrell was able to move his eyes in a fashion that he blinked 5 times. And this is how physicians at the time understood that he was indeed locked in. And he was transferred to us. So he had no home medications he was taking at the time. He was not a smoker. He was not a heavy alcohol abuser. He lived in Friendswood. At the time he was in Dallas, he had an apartment there as far as work, because he worked for NASA. I don't know exactly, other than to say that it's all top secret, and he was some form of a rocket scientist, to say the least. Someone told me, and maybe the family could say more about this later, but my understanding is he was in charge of a big team of people that was actually involved with working out the calculations for the space shuttle to dock with the space center, and that these two bodies are moving extremely high speeds, and he was able to find a way for these two things to dock within the precision of about 1/4 of an inch.
He has a United States patent on that.
It's a patent on docking between space shuttles. So he has a brother, or he had a brother at the time who had already had a stroke, actually, that was secondary to an AVM. When I saw him when he was here, he was in the neuro ICU, he was in bed 1. Many of you may remember him because you may have taken care of him. He was in the ICU there for at least 2 weeks. His vital signs were stable. He was intubated, but he was awake. His pupils were reactive. They were 3 millimeters. He did have volitional vertical eye movements, but nothing horizontally. He was able to blink for me to command, so 1 blink for yes, 2 blinks for no. He did, however, have no spontaneous facial or extremity movements. That being said, the left arm would extend slightly to noxious stimulus, and his reflexes were upgoing, and hyper-reflexive with Babinski signs. This is his MRI of the brain.
Wow.
And I think most of us can appreciate that in ponds, there's large territory of damage visible on DWI, where most of these, or almost all the motor tracks are running, and so this is a cross-section of his brainstem. He was diagnosed with a basal artery thrombosis that was found on CT angiogram. However, we never found a source. His transesophageal echo was negative. He did have a PFO, but there were no blood clots found in his lower extremity Dopplers or his MRV of the pelvis. He was diagnosed with a cryptogenic stroke, an unknown cause of stroke, and we ran all sorts of lab tests to look for other hypercoagulable disorders. None of those were found. Mr. Paldro has a friend of the family who's actually a neuroscientist who happens to be with us today, Dr. Clark, who is a PhD neuroscientist and also a physician, and he heads Clear Lake Regional Rehab Hospital, I believe, if I'm getting the name right or wrong.
Clear Lake Rehab.
And he's here with us today. And the family had called him, and he had called me, and he had recommended a cocktail of these medications that you see here, which the hope was that these medications would and supplements would hopefully be beneficial for Mr. Paldro's brain and spinal cord and for all of his, hopefully, improvement. And so we started those, and he's been on those for many years now, not all of these. During the hospitalization, he did undergo a PEG tube placement for feeding and a tracheostomy, and I'm happy to say now that those have been removed for a few years. He's now eating by mouth. He was on a portable ventilator that's obviously been removed, and he was discharged to Tier Rehab Hospital after about 12 days stay in our hospital. So that's the background in terms of